Namaste. Today, the world is celebrating International Mental Health Day 2025. Mental health is a state of mental well being and basic human right. Mental health is important because it affects our quality of life. The color for World Mental Health Day is green, which represents mental health awareness, hope and optimism, support and strength, stigma reduction, while the global theme for World Mental Health Day 2025 is Access to Services, Mental Health in Catastrophes and Emergencies, highlights the urgent need to ensure mental health and psychosocial support reaches people affected by conflict, disaster, and displacement. In 2025, this call is more pressing than ever as humanitarian needs continue to rise worldwide. Together, we must ensure that all people affected by crises and access to the care they need. But a significant and critically gap in exists globally and within communities due to poor awareness and understanding of mental health wellness, distress and disorders, hindering individuals from seeking timely help and leading to increased suffering, stigma, and poor overall health outcomes. It is right to assess mental health care and treatment which are affordable, of good quality, available in sufficient quantity, accessible geographically without discrimination, and acceptable for persons with mental illness and their families and caregivers. Range of access to services that shall be available from community health center and upwards in the public health system. Outpatient and inpatient services, halfway homes, shelters, supported accommodations, hospital, and community based rehabilitation, child and geriatric mental health services. Every person shall have a right to access mental health care and treatment from mental health services run or funded by the government. Integrate mental health services into general mental health care services. Minimum mental health services are available at each district. Free treatment for poor, homeless, and essential drugs should be available. Mental health care becomes a reality both in normalcy and also during disasters. This year's theme is very important and necessary so that the people should have access to mental health services in catastrophes and emergencies. To achieve integrated, accessible, and comprehensive mental health care, Nepal needs political commitment, policy implementation, and increased funding for mental health services. Hence, it is time to unite, to raise our voice and walk out for the fundamental right of mental health to the people. Namaste. Have a good day.